Let me ask you an important question. In a hospital, who spends the most time with the patient? The answer is nursing staff. Doctors create the treatment plan, but 24/7 patient care is mainly provided by nurses. Now imagine if nursing care is not standardized, clinical protocols are not followed, nursing documentation is incomplete. This can seriously affect patient safety and treatment outcomes. That is why NABH introduced the COP-6 standard, which ensures that nursing care is provided according to structured clinical protocols. What you will learn in this video. In this video we will clearly understand what NABH COP-6 standard says, what assesses check in nursing care, common mistakes hospitals make, and how hospitals can become COP-6 compliant. Let's begin. What is NABH COP-6 standard? The COP-6 standard states, nursing care is provided to patients in the organization in consonance with clinical protocols. This means that nursing care must follow defined clinical guidelines and standard operating procedures. Standardized nursing care ensures patient safety, continuity of care, consistent treatment practices. Objective elements of COP-6. The COP-6 standard includes several important elements such as written guidance for nursing care, appropriate patient care assignment, acuity-based nursing staffing, nursing care plan documentation, availability of nursing equipment, empowerment of nurses for patient care decisions. During NABH assessment, assessors verify these through nursing documentation, staffing patterns, staff interviews. Written guidance for nursing care. Hospitals must maintain documented nursing manuals or SOP. These SOP may include monitoring vital signs, medication administration, patient hygiene care. These guidelines help nurses provide standardized care across the hospital. Nursing clinical practice guidelines. Hospitals should also develop nursing clinical practice guidelines for specific clinical conditions. Examples include healthcare-associated infection, HAI, prevention, pressure ulcer prevention, deep vein thrombosis, DVT, risk assessment. These guidelines are usually based on evidence-based clinical practices, standard treatment protocols. These guidelines should be reviewed and updated at least once a year to incorporate the latest clinical practices. Assignment of patient care. Patient care must be assigned to nurses based on patient clinical condition, nurse competency. Factors considered include nurse experience, clinical competence, patient acuity. This ensures appropriate care for each patient. Acuity-based nursing staffing. One important element of COP-6 is acuity-based staffing. This means the number of nurses should depend on patient severity and care requirements. Proper nurse staffing has a direct impact on pressure ulcer rates, patient fall incidents, medication errors, ventilator-associated pneumonia. That is why NABH considers nurse staffing an important quality indicator. Nursing care plan. Hospitals must develop a nursing care plan for every patient. This care plan should be individualized, based on patient clinical needs. Key components of a nursing care plan include assessment, care planning, implementation, evaluation, modification of the care plan. The nursing care plan must also align with the overall patient treatment plan to ensure continuity of care. Nursing documentation. Nursing staff must maintain accurate and timely documentation. Nursing documentation should include nursing interventions, patient response to treatment, clinical observations. Documentation should not be limited to vital signs monitoring only. It should also include patient condition updates, nursing interventions performed, patient progress. Proper documentation ensures continuity of care and legal compliance. Availability of nursing equipment. Nurses must have access to appropriate patient care equipment. Examples include nebulizer machines, glucometers, blood pressure apparatus, thermometers. Equipment should be suitable for the patient population. For example, pediatric BP cuffs, adult BP cuffs. This ensures accurate monitoring and safe patient care. Nursing decision making. According to COP-6, nurses should have the authority to take certain patient care decisions. However, these decisions must be within their defined scope of practice. Examples include monitoring patient deterioration, initiating basic nursing interventions, informing doctors when required. Hospitals must ensure that nurses are aware of their scope of practice and follow clinical protocols. Common NABH non-conformities in COP-6. During NABH assessments, common observations include nursing SOP not documented, nursing care plans not maintained properly, incomplete nursing documentation, inadequate nursing equipment, nurses unaware of their scope of practice. Hospitals should address these issues to avoid assessment non-conformities. How hospitals can become COP-6 compliant. Hospitals can comply with COP-6 by developing a nursing SOP, manual, implementing nursing care plans, adopting acuity-based staffing, strengthening nursing documentation, ensuring availability of nursing equipment. These steps help hospitals effectively comply with NABH COP-6 standards. In the next video of this NABH training series, we will discuss COP-7 clinical procedures are performed in a safe manner. If you want to learn NABH standards step by step, then like this video, subscribe to the channel, turn on the notification bell, so you never miss upcoming NABH training videos. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.